Hong Kong will lift a flight ban on 9 countries from the 1st of April. That includes the United States and Britain. Quarantine for travellers will be cut to 7 days if they test negative daily. The changes come as the city's 5th coronavirus outbreak starts to plateau. Deborah Wong with this report.
The clouds are finally parting in Hong Kong's 5th COVID-19 outbreak. Daily cases are marking a downward trend, with the ratio of positive cases dropping more than 10% over the last few days. The pressure on the Hong Kong government, however, has mounted in recent weeks, with the international business community calling for a clear COVID-19 exit plan and for flight bans to lift. However, Chief Executive Carrie Lam's latest decision to do just that doesn't come lightly.
係已經不合時宜啦因為佢哋嘅疫情咧不比香港差，而且咧大部分翻嚟嘅咧都係冇乜病徵嘅人士但係如果繼續有呢個地區性航班熔斷機制，就會令到大量滯留喺9個國家嘅香港人係帶嚟極大嘅困擾。
But the approach will be a calibrated one. Travellers entering must be vaccinated and be tested daily. One expert says Hong Kong needs to step up surveillance and testing at airports, because even as official daily infection figures come down, the city isn't completely out of the woods.
There are a lot of people who are testing themselves at home, finding they have COVID, and then out of fear of being sent to quarantine or isolation facilities, simply remaining at home and not reporting those numbers. So we have to assume that the numbers are higher. How much higher, we don't know, but definitely higher than the reported numbers. So there's still a need for us to keep those social distancing measures in place.
Mrs. Lam says social distancing measures will ease in phases from April 21st. Now, this includes expanding public gathering limits eventually to 8 and reopening venues like libraries, gyms and bars that have been closed since January.
If the measures can be effective earlier, for example, by next week, it would be much better. Because accordingly, we have already 92% of the population already taken the jabs or the vaccinations, and about 82% of the population have already received the second vaccination. So in this case, I think the government does not need to be worried.
Still, Mr. Wong is assured that there is at least a roadmap in place. But the same can't be said for Hong Kong's universal testing plans, with Mrs. Lam saying that now isn't the right time to do it. And she says Hong Kong cannot roll it out in the same scale as the mainland can, with its finite resources and weaker organizational capability. Now, this also drew the question of whether the city still aligns itself with Beijing's strict zero-COVID strategy, and if it still has its eye on prioritizing reopening with the mainland.
Many international businesses have chosen Hong Kong is because of our accessibility to the mainland market and also, of course, in Asia-Pacific region. So for any longer-term public health strategy, we will have to take into account both factors. That is maintaining Hong Kong's accessibility to the mainland and also ensuring her continued connectivity with the outside world.
Regardless of the restrictions, Hong Kong still requires residents to keep face masks on and use its contact tracing app as safeguards. Deborah Wong, CNA, Hong Kong.